Hi, Miss Hannah. I'm Tyann, and I'm going to be the nurse helping you today. How are you doing today? You're feeling nervous? Oh no, there's nothing to be nervous about. Everything's going to go great. Your dermatologist, Dr. Yi, he's really one of the best. He's truly phenomenal. Before I get started with going over everything with you, Hannah, at any time, if you have any questions or concerns, just let me know, okay? I'm more than happy to go back over everything with you, re-explain it. Just let me know, alright? Okay, great. So today, Hannah, we're going to be taking care of your basal cell carcinoma that is on your cheek. Dr. Yi had explained previously that this is a tumor that's within the epidermis, or the top layer of your skin. And in order to remove the cancer cells, Dr. Yi is going to perform the Mohs procedure. Did he explain to you what that is at your last appointment? I figured he did. He's typically really good about letting his patients know what's going on and what's going to happen. I'm just going to re-explain the Mohs procedure to you, or the Mohs surgery to you, to make sure you fully understand, okay? Okay, first the surgery, you will be awake during this. I know it's kind of scary with the word surgery and being awake, but it's not as intense as you think it's going to be. It's more of a procedure, but it is named a surgery, so please don't let that be a concern for you. First, Dr. Yi, he is going to re-examine the area on your cheek again, and he's going to outline where he wants to treat. After he has determined exactly where he wants to treat, he is going to use a local anesthetic to numb the area. After the area is completely numb, okay, Dr. Yi is going to use a scalpel to remove a thin top layer of the visible tumor. That layer is going to be sent to the lab for analysis. During this time, you are going to be able to relax and have just a bandage over your cheeks so nothing goes wrong with it. At the lab, Dr. Yi is going to map out the surgical site, where your cheek is, how everything looks. He is then going to use a microscope to examine the layers of the sample, and he's going to map out where those layers match up with the map that he's drawn. He's going to look at the cells and everything underneath the microscope, and at that time he's going to see if there's any margins left by, or if the layers show that there's clean margins. Also, if there's like healthy tissues around. If it's determined that there are not, and there's more cancer cells that are left behind, he is going to have to go back in for another layer. He does want to make sure that he gets all the cells out, all the cancer cells, so you're obviously cured, okay? He's going to repeat this process of going back in, getting a layer, and then examining it and comparing it to where the map is until all the cells, the cancer cells, are gone, okay? Because Dr. Yi may have to go back a few times to get all the cancer cell out. The surgery may take some time, okay? It's completely normal for it to take more than a few hours. After Dr. Yi removes all the cancer cells, he'll stitch up that area. It's really important to follow his aftercare instructions, okay, Hannah? The Mohs surgery has minimum scarring because Dr. Yi is going to leave as much healthy tissue as he can behind. His goal is to just get the cancer cells out. He's not wanting to take out all the healthy skin, okay? But it is still very important that you follow the aftercare instructions to minimize the amount of scarring that there will be. Sound good? Okay, great. As far as removing your stitches go, we want to see you back in about 7 to 10 days. Do you have a specific day and time that I can schedule you for? Does anything really match up on your schedule? Okay, perfect. That works out perfectly for it, Hannah. Dr. Yi is going to take great care of you. This surgery is the gold standard. You're having one of the best dermatologists perform this, okay? There's really nothing to worry about, alright? Okay, sounds great, Hannah. He'll be in here to take care of you in just a second, okay?